Have you ever wondered how crucial the correct placement of your newborn baby can be? Welcome to the journey of parenthood, a world filled with wonder, joy, and yes, a few challenges. One of these challenges, and perhaps one of the most important, is ensuring the safety of your little one, especially during their sleep. Understanding the importance of correct baby placement is paramount for new parents. It's not just about comfort, but about taking preventative measures against certain risks, including the sudden infant death syndrome, or SIDS. As daunting as it sounds, knowing about it is the first step towards preventing it. So, what is SIDS? It's a term used to describe the sudden and unexplained death of an apparently healthy baby. The exact cause of SIDS is unknown, but it's believed that incorrect placement during sleep can contribute to it. This is why correct baby placement becomes an essential part of your parenting toolkit. Incorrect placement can lead to situations where the baby's breathing could become obstructed, such as when the face is covered by soft bedding or when the baby is sleeping on their stomach. This could potentially lead to SIDS. It's a frightening thought indeed, but the good news is that correct baby placement can significantly reduce the risk. Now you might be wondering, what is the correct placement for a newborn baby? Well, the safest position for a baby to sleep is on their back, in a crib or bassinet with a firm surface. This position allows for clear airways and minimizes the risk of suffocation. But remember, correct baby placement isn't just for sleep. It's also important during feeding, playtime, and when the baby is in a car seat or stroller. After all, the safety of your little one is a round-the-clock job. As we embark on this journey of understanding correct baby placement, let's keep in mind that every effort we make, every minute detail we pay attention to, can make a huge difference in the life of our little one. It's about creating a safe, loving environment for them to grow and thrive. Let's dive deeper into the correct way of placing your newborn baby to ensure their safety. Before we proceed, it's important to understand what sudden infant death syndrome is. Often abbreviated as SIDS, this term refers to the unexplained passing away of an otherwise healthy baby during sleep, usually within the first 6 months of life. SIDS is sometimes known as crib death, because infants often pass away in their cribs. Although the exact cause of SIDS is unknown, it's believed to be associated with defects in the portion of an infant's brain that controls breathing and arousal from sleep. Researchers speculate that babies who die from SIDS are somehow not able to sense or respond to such things as a buildup of carbon dioxide in their blood. There are several risk factors that might increase a baby's vulnerability to SIDS. For instance, SIDS is more likely in babies who sleep on their stomachs or sides, those exposed to secondhand smoke, and those sleeping in an overly soft bed. Babies born prematurely or with a low birth weight or who have a sibling or cousin who died of SIDS are also at a higher risk. One of the most significant risk factors, and the one we're focusing on today, is incorrect baby placement during sleep. Studies have shown that babies placed on their stomachs or sides to sleep have a higher risk of SIDS compared to those placed on their backs. This is because such positions can increase the baby's chance of suffocation, overheating or rebreathing exhaled carbon dioxide, all of which can contribute to SIDS. It's important to note here that while these factors may increase a baby's risk, they don't necessarily mean that SIDS will occur. Many children with one or more of these risk factors will never be affected by SIDS. Still, understanding these risk factors can help us take steps to reduce the likelihood of this heart-wrenching event. Now that we know what SIDS is, it's time to learn how to prevent it. Proper baby placement isn't complex, but it's crucial for your baby's safety. When it comes to laying your newborn down to sleep, understanding the correct placement is vital. It's all about creating a safe sleep environment. So let's dive right into it. The first rule of thumb is to always place your baby on their back to sleep. This applies to both nap time and nighttime. Why is this position so important, you might ask? Well, studies have shown that babies placed on their backs are less likely to suffer from sudden infant death syndrome, or SIDS. This is because this position allows for optimal oxygen flow and minimizes the risk of suffocation. Now, let's talk about the surface your baby is sleeping on. It needs to be firm. This doesn't mean it has to be hard, but it should not indent when your baby is lying on it. Avoid using soft surfaces like pillows, quilts, sheepskins, or loose bedding in your baby's sleep area. These can create pockets of air around your baby's face and increase the risk of suffocation. A firm mattress with a fitted sheet is all you need. And speaking of covering, let's move on to our next point, ensuring your baby's face isn't covered during sleep. It's vital to keep blankets, stuffed toys, and other items out of your baby's crib or bassinet. These items may look cute and cozy, but they pose a real risk of suffocation and overheating. If you're worried about your baby getting cold, consider using a sleep sack or swaddle wrap instead of loose blankets. But what about when your baby starts to roll over? It's a proud moment for any parent, but it can also bring new worries, especially during sleep time. Here's the good news. Once your baby can roll from back to front and front to back, you don't need to worry if they change positions during sleep. By this stage, they can move enough to prevent suffocation. And finally, while it's important to place your baby in their own sleep area, that doesn't mean they need to be in a separate room. In fact, having your baby sleep in the same room as you for at least the first 6 months can further reduce the risk of SIDS. They should still have their own firm sleep surface, but being in the same room allows you to monitor them more closely. Remember, these steps are simple, but they could save your baby's life. So, always place your baby on their back, on a firm surface, with nothing covering their face. And when they're old enough to roll over, let them find their own comfortable position. By following these guidelines, you're doing your best to ensure your baby is sleeping as safely as possible. Remember, these steps are simple, but they could save your baby's life. In contrast, let's examine what you should avoid when placing your baby. As we navigate through this journey, it's important to remember that these precautions aren't meant to scare you, but rather to equip you with the knowledge to ensure your baby's safety. Firstly, resist the urge to place your baby on their stomach or side for sleep. While it might seem like a comfortable position, these placements can lead to difficulty in breathing, thus increasing the risk of sudden infant death syndrome or SIDS. It's crucial to remember that the safest position for your baby to sleep is on their back, which allows for unrestricted airflow. Next, let's talk about the bedding. It may be tempting to create a plush, cloud-like environment for your little one. However, soft bedding can pose a significant risk. Soft materials can potentially obstruct your baby's breathing and lead to overheating. Therefore, it's best to opt for a firm sleep surface, such as a safety-approved crib mattress covered with a fitted sheet. Lastly, be mindful of covering your baby's face. While we might think that covering a baby's face can protect them from cold or bugs, it can actually lead to suffocation. It's best to ensure their face remains uncovered and clear at all times. Instead of a blanket, consider using a sleep sack or footed pajamas to keep your baby warm. It's also worth noting that these precautions are particularly important during the first year of your baby's life, a period when they are most vulnerable to SIDS. By following these guidelines, you're not just promoting better sleep for your baby, but also providing a safer environment. In conclusion, while the joy of welcoming a newborn into your home is immense, it's equally important to be informed about the potential risks. By avoiding incorrect baby placements such as sleeping on the stomach or side, using soft bedding and covering the baby's face, you're taking significant steps towards ensuring their safety. Avoiding these mistakes can significantly reduce the risk of SIDS. Remember, knowledge is power, and in this case, it could be a lifesaver. In addition to correct placement, there are other ways to ensure your baby's safety. Let's delve into some additional tips that can help you safeguard your little one, reducing the risk of sudden infant death syndrome, or SIDS. Understanding these recommendations and putting them into practice can give you peace of mind and provide a safer environment for your baby. First, consider the sleep environment. While it's natural to want your baby close to you, especially when they're sleeping, it's essential to keep the baby's sleep area separate but close to where you sleep. This practice, often referred to as room sharing, allows you to monitor your baby closely and can decrease the risk of SIDS by as much as 50%. It's important, however, to avoid bed sharing, which can lead to accidents like suffocation or strangulation. Next, let's discuss temperature control. Overheating is a significant risk factor for SIDS, so it's important to keep your baby comfortable, but not too warm. Dress your baby in light sleep clothing and keep the room at a temperature that's comfortable for an adult. If your baby is sweating or their chest feels hot, they may be overheated. A simple rule of thumb is to dress your baby in no more than one more layer than you would wear to be comfortable. Pacifiers can also play a role in reducing the risk of SIDS. Consider offering a pacifier when putting your baby down for a nap or at bedtime. If your baby isn't interested or the pacifier falls out after they fall asleep, there's no need to force it. But if your baby accepts the pacifier, it can be a helpful tool in reducing SIDS risk. If you're breastfeeding, wait until breastfeeding is going well before introducing a pacifier, typically around the age of 1 month. Lastly, remember to keep your baby's sleep area clear of any potential hazards. This includes pillows, blankets, toys, and crib bumpers. These items can increase the risk of suffocation, entrapment, and strangulation. Instead, Opt for a firm mattress covered by a fitted sheet and nothing else. It's worth noting that these tips are not meant to replace the advice of a healthcare professional, but to supplement it. Always consult with your healthcare provider for personalized advice and guidance. By integrating these tips into your daily routine, you're creating a safer sleep environment for your baby. Remember, every small action counts and consistency is key. It's all about creating safe habits that become second nature over time. By following these additional tips, you can further reduce the risk of SIDS. And that, after all, is the goal: to provide the safest possible environment for your little one to grow and thrive. Let's recap what we've learned today. We began our journey by discussing the importance of correct baby placement. It is not just a matter of comfort, but it's also a vital part of ensuring the safety and well-being of your newborn. Proper placement can significantly reduce the risk of the sudden infant death syndrome, also known as SIDS. We dove deep into understanding SIDS, a grave concern for many parents worldwide. It's a term used to describe the sudden and unexplained death of an apparently healthy baby, typically during sleep. The exact cause remains unknown, but we do know that certain risk factors can increase the occurrence, including incorrect baby placement. And so, we delved into the correct baby placements. We learned the importance of placing the baby on their back, not their tummy or side, for every sleep until their first birthday. We stressed the necessity of a firm sleep surface, such as a mattress in a safety-approved crib, covered by a fitted sheet. We noted that soft objects, toys, crib bumpers, and loose bedding should be kept out of your baby's sleep area. A clear space is a safe space. We also highlighted the incorrect baby placements. For instance, letting the baby sleep on soft surfaces like an adult bed, a couch, or a chair, or with loose bedding, toys, or crib bumpers can be dangerous. And remember, while it may seem cozy to share a bed with your newborn, bed sharing can be risky and is not recommended. It's safer to share a room, not a sleeping surface. Finally, we shared additional tips for baby safety. These included the importance of breastfeeding, considering using a pacifier at nap and bedtime, ensuring the baby gets regular checkups, and avoiding exposure to smoke, alcohol, and illicit drugs. We also discussed the importance of providing tummy time when the baby is awake and supervised, which can help strengthen the baby's neck, shoulder, and arm muscles. By placing your baby correctly and following these safety tips, you can provide a safe sleep environment for your newborn and reduce the risk of SIDS. Remember, every little step, every mindful action, can make a significant difference in your baby's safety. And while it may seem like a lot to remember, with time, these steps will become second nature to you, just like nurturing and loving your little one. We hope this video has been informative and has equipped you with the knowledge to make the best decisions for your newborn's safety. Let's continue to create a world where every baby can sleep safely, and every parent can sleep soundly, knowing they've done everything they can to protect their precious new addition. By placing your baby correctly and following these safety tips, you can provide a safe sleep environment for your newborn and reduce the risk of SIDS.